How do long-term steroids affect children with juvenile arthritis? Imagine a young child battling joint pain and swelling that just won't go away. Doctors often turn to medications called corticosteroids to help control the inflammation. While these medicines can be very effective in reducing symptoms quickly, using them over a long period can have important effects on a child's health. One of the main concerns is how steroids impact growth and bones. Children with juvenile arthritis who take steroids regularly may experience slower growth, leading to a shorter final height compared to their peers. This happens because steroids can suppress the growth hormone that helps children grow taller. They also directly affect the growth plates in bones, which are essential for bone lengthening. Additionally, steroids can weaken bones by reducing the activity of cells that build bone and impairing mineralization. This increases the risk of developing weaker bones, known as osteopenia, and makes fractures more likely. Studies have shown that children on higher doses of steroids, especially above 0.2 milligrams per kilogram of body weight each day, tend to have more noticeable growth delays and lower bone density. Sometimes, doctors may consider growth hormone therapy to help, but it cannot fully reverse the growth effects caused by steroids. Steroids can also influence how the body manages sugar and fats. Children on long-term or high-dose steroids are at a slightly higher risk of developing conditions like diabetes or high blood pressure. These risks are more common in children with autoimmune diseases like juvenile arthritis, but they are still important to watch for. Regular checkups help ensure that any metabolic changes are caught early and managed properly. Another important effect is on the adrenal glands, which produce natural steroids that help the body respond to stress. When children take steroids for a long time, their adrenal glands may stop making enough natural steroids. This condition, called adrenal insufficiency, can be dangerous if the child gets sick or experiences stress, because their body cannot produce enough steroids to cope. Children with higher cumulative doses of steroids are more likely to develop this problem, so doctors carefully monitor adrenal function during treatment. Steroid use can also cause mood swings, irritability, or behavioral changes, especially at higher doses. These effects can be challenging for children and their families, but they are usually manageable with proper support. Despite these potential side effects, steroids are often necessary to control severe inflammation in juvenile arthritis. Doctors aim to use the smallest effective dose for the shortest time possible and often combine steroids with other medications like biologic drugs to reduce the need for long-term steroid use. The goal is to balance controlling the disease with minimizing side effects. In summary, long-term steroid treatment in children with juvenile arthritis can slow growth, weaken bones, increase risks for metabolic problems, and affect adrenal function. These effects highlight the importance of close medical supervision. Regular checkups to monitor growth, bone health, blood pressure, blood sugar, and adrenal function are essential. Always remember that every child's situation is unique, so treatment plans should be personalized and discussed with healthcare professionals to ensure the best possible outcomes.